Hi, this is Dr. Jason Hochfelder with Hudson Valley Bone and Joint Surgeons. Today we're going to talk about a common injury, and in fact, we're specifically going to be talking about Adrian Peterson, running back for the Minnesota Vikings, who's out with a meniscus tear. Whenever you think about meniscus tear, it's important to break it down really into two main categories, those that are fixable and those that are not, okay? And what is the meniscus? Here we have our knee, this is the front, this is the kneecap. Then we have the inside part and the outside part. And the ends of the bone is cartilage, okay, which acts like a cushion. But then we also have another piece of cartilage on the inside here called the meniscus, and the other meniscus here. So we have two menisci, one on the inside and one on the outside. If the tear is in a certain spot, all we'll do is actually go in and shave out that part that's torn, because some parts don't have a good blood supply. And if they don't have a good blood supply, then we know for a fact that they're not going to be able to heal. So if it's torn in a way that's not amenable to being fixed, then the treatment would be going in there arthroscopically, meaning just two little micro incisions right here and right here, and shaving out that portion. If that's the case, there's nothing left that needs to heal on the inside, and all that needs to heal is the two little incisions on the outside. And if that's the case, really the only recovery is just regaining the strength and flexibility and getting rid of the soreness from the operation. In this case, people can get back to sports and athletics relatively quickly. Yes, you still need to wait for some of the soreness to go down, and obviously, like I said, the incisions to heal, but that could be from anywhere from a few weeks to a month or two. If it's a type of tear that's in a spot which can heal, which if you think about it, it's actually good, because then we don't need to take out any of that meniscus in there at all, and meaning we're leaving a lot more of the cushion in, then it takes a lot more time to recover, because not only do you need to recover from the soreness and the incisions from surgery, you need to give that meniscus a time to heal. The blood supply needs to return. Your body needs to actually amend it to the spot that it was torn off from. This means a period of non-weight bearing, meaning being on crutches and taking pressure off of it to allow it to create a good environment for healing. So I don't know exactly what type of tear Adrian Peterson had, but the fact that he's out for so long and missing the whole season makes it more likely that he has a type of tear that is going to be fixed, because like I said, the recovery for that is a lot longer. The other thing that helps meniscus tears heal better too is age. Younger people have a much higher chance of the meniscus healing, as opposed to people who are upwards of 40 years old, if not older. In that case, the blood supply tends to be diminished to all areas, and meniscus tear tends to heal at a lot lower rate. So I think it's important to realize that not all meniscus tears are the same. Some are able to be fixed, some are not. Sometimes we don't even know until we get in there at the time of surgery. We might think on the MRI that it looks like it can't be fixed, but then we get in there and we realize it can, and sometimes vice versa. So even really until after surgery, we don't know exactly what the recovery is going to be, but we do know is that we can't treat every person the same, and that we can't treat every meniscus tear the same, and we have to treat each person and each tear individually.